The main achievements of CHAIMELEON was the deployment of a platform. And on that platform, we were collecting cases. Finally, there are more than 10,000 cases of oncologic patients coming from breast, lung, prostate, colon, and rectum. But it's not only collecting cases, it was also harmonizing those images to allow imaging biomarkers and radiomic features to be reproducible. And that was one of the main achievements of CHAIMELEON. And why do we want biomarkers to be reproducible? To predict endpoints. And we made also the exercise of prediction models by using non-harmonized and harmonized imaging features. And on that clinical validation, with more than 1,500 cases and so many physicians and radiologists also in training with different levels of expertise, we did demonstrate that clinical validation on the platform is feasible, that AI-developed models on harmonized images are better, and the success of CHAIMELEON now is to provide those cases and tools to the EUCAIM infrastructure. Therefore, we will provide those cases and clinical data with the interoperability needs, understanding that both the EUCAIM platform will understand those cases from CHAIMELEON when they are transferred, and also we will provide the clinical validation tools to the EUCAIM network of tools, to the catalog. So CHAIMELEON is fully being transferred, data, tools, and community to the EUCAIM infrastructure. We are now deeply working on the deployment of the EUCAIM platform that has been done in these first 2 years on the federated learning approach to allow data to be shared between different partners. We have populated a central repository, the Atlas of Cancer Images, which is growing with millions of images. Also, we have populated the repository of software able to perform preparation of images, denoising, resizing, normalization, harmonization tools. And we did prepare all that environment to allow researchers to perform high-quality research on AI to improve models that will predict when we do a CT or an ultrasound or a PET or an MR study, which type of tumor do we have there, the characteristics, the genetic expression, the molecular profile, the response to treatment, the tendency to invade lymph nodes or metastasize to distant organs. And by doing that with one single exam, we will change in some way the decisions at the clinical level, because we will have a huge amount of new information to target more precisely treatments. We are so proud that in EUCAIM we are able to help researchers to do that by having this huge amount of data, centers, hospitals, institutions, and software in a network of collaborations for the best of precision medicine. And for EUCAIM, what we are doing now is also the construction of the long-term sustainability of the infrastructure. And we are doing that through a declaration of the importance of medical imaging in medicine, with a notification to the European Commission. We are applying for, in fact, an EDIC, which is an European Digital Infrastructure Consortium, Innovation Consortium, having a legal entity and being a participant in the European health data space for the secondary use of data, helping researchers with this huge infrastructure.